The death toll from the earthquake in southwest China's Yunnan province has risen to 617. 112 people remain missing, more than 3,000 people still injured. Over 11,000 Chinese armed forces, police, and militia are taking part in earthquake relief. They have saved 460 people. Meanwhile, rescuers are still working to defuse the threat of a growing barrier lake in the quake region. The water level is rising rapidly, and the lake is at risk of overflowing. Several excavation machines are operating at the top of the dam to dig a flood relief channel. That is expected to be finished by Tuesday. 5,000 nearby residents have been relocated to safer ground. The central government has so far allocated more than $250 million for rescue work and disaster relief. In an interview with CCTV, Vice Civil Affairs Minister Zhong Li spoke of the biggest challenges the disaster-stricken area is faced with.
The challenge right now is not that we don't have enough relief supplies. For example, we have acquired 70,000 tents, more than what we need. But there isn't enough space to pitch all the tents because of the difficult geological conditions. And the difficult environment has brought obstacles to disaster relief work, especially when it comes to transportation. So the next priorities are preparing the roads, treating the injured, preventing outbreak of communicable diseases and secondary disasters.
As of Friday, about 100,000 relocated people are living in tents and other temporary shelters. Necessities, including quilts, overcoats, rice, oil, and portable toilets, have reached them. But there's still the matter of their physical and emotional injuries. CCTV's Wu Lei spoke with a doctor about the challenges in his work.
The earthquake left the only hospital in Longtoushan Township in ruins. 4 doctors and nurses lost their lives here. Although the tragedy is a blow to hospital chief Shapu, he leads the surviving doctors and nurses in the relocation center. They come to check patients 3 times a day. Many suffer from colds and diarrhea.
Maintaining proper living habits is crucial to improving overall hygienic conditions. Survivors must drink clean water, don't use any water which may be contaminated by the quake, and pay careful attention to personal health.
Over 3,000 survivors are now relocated here. Besides providing free basic medicines, the team distributes health manuals as a reminder. As more medical supplies arrive, Shapu says he and his colleagues will do their best to treat the physical hurts. But he knows some patients are suffering from headaches and nightmares, especially the young.
Most of them have never experienced such a strong earthquake. Some survived, but others may have lost family members. They're struggling to get through this painful period.
Most doctors in this township don't have the expertise to provide psychological intervention. Survivors need professional help to help them understand and regain their sense of reality. The doctor said the earthquake also struck in the hearts of the victims who are still feeling aftershocks. He hopes survivors will get timely psych help, or they may end up carrying a lifelong trauma. Wu Lei, CCTV, Longtoushan Township.